nurse. I started out in the NICU. I've been a nurse for about 8 years now. I worked with Casey for several years with PSA also, and then with Epic Health Services, and most recently I've been in labor and delivery. So kind of bounced all over the place, but that's what makes life fun. I'm also a mom to a very sweet 4-year-old little girl with autism. So I do have some background and some special needs. Being a special needs parent, I understand kind of a little bit, small portion of what those struggles can be like. And so I wanted to really just make the CPR about children from 1 year old until puberty. So if you guys have any specific questions about like infant CPR or CPR for pregnant ladies, all of those things kind of look a little different. So we'll kind of keep that focus for 1 year old until puberty. So I know as parents, we're not only our child's biggest advocate, but we're usually the first line of defense for them when they fall into an emergency situation. So it's really important for us to have some idea of how to respond in an emergency or in that worst case scenario. So I wanted to first off say, if we ever find a child in an emergency situation, a situation where they're unconscious, our first result, our first line of defense is going to be to call 911. And so I wanted to really reiterate that. I know as parents, we always want to run to our child and kind of comfort them or figure out what we can do to help. But getting those first responders on the way is huge, not only so they have an avenue to get to the hospital, to get to a place where they can get that top-rate care, but also so we can get medications to them that they might need. I don't think we always think about all the medications that are on that ambulance that could help our child if they really were in an emergency situation. So let's talk about when to initiate CPR. So like, when do we start CPR? When do we start compressions? When do we know when to start that sequence of events? So CPR is for a patient or a child who is unconscious, without a pulse, and without respiration. So all three of those things are present before we actually would start compressions. Just to make sure
Can you say those three again?
No pulse, no breathing, and unconscious, so not arousable. So I wanted to talk about how to find a pulse, because my husband was like, well, I wouldn't know how to find a pulse. And I'm going, okay, well, let's start there. That's a good place to start. So the recommended place to find a pulse on a child is the carotid pulse, so that's here in the neck. Recommended place to find a pulse on an infant is actually the brachial pulse, which is the inside of the elbow, kind of more toward the interior part. I know special needs kids never follow the recommended protocols, so I want to just wipe all of that clean for a second and say, know what's right for your kid. So practice finding a pulse on your child. Where can you find it the best? Where can you feel it the strongest? There are pulses in the radial pulse, which is kind of here in the wrist, right alongside of the thumb. Also the brachial pulse, the carotid pulse, of course, that's what you see in the movies. There are also pulses in the feet. So like the top of the foot and then on the side of the foot by the ankle. Just kind of practice, feel around, hang out when your kid's asleep, see where you can find that pulse the strongest and go with that. Let that be your go-to spot for finding the pulse if that emergency situation were to occur.
Emily, is it a myth that you're not supposed to use your thumb because you'll feel your own pulse?
It's not actually. You can truly feel your own pulse, especially if you're in an adrenaline-inducing situation such as that. You can truly feel your own pulse through your thumb. So I would recommend using one of your fingers. Good question. Let's see. So some of you guys may have pulse oximetry machines in your homes. I think those are very reasonable to utilize in emergency situations. I just wanted to kind of remind you that if your child truly has no pulse or no respirators, that machine's going to alarm and beep and make all kinds of crazy noises. So the recommended time from start of finding a child with no pulse and starting compressions is 10 seconds. So if we can get that pulse ox on the child and get everything going in less than 10 seconds, that's great. But we don't want to be fumbling with machines, worrying about alarms. I don't want that to be a distraction in an emergency situation. Let's see. So if you've been certified in CPR in the past, a few things have changed. In 2015, the American Heart Association changed some of their guidelines for CPR. So it used to be the ABCs. So airway, breathing, compressions. That's how it was always taught. It was the easy acronym to remember all of those things. So in 2015, they actually changed that to compressions, airway, and then breathing. So the big initiative was they found in a lot of their research that starting compressions sooner really allowed that oxygen to circulate and saved a lot of the brain from a lack of oxygen incident. So that was their biggest push and probably the most important thing that they changed in 2015 was to start those compressions first.
And what was the second? Excuse me, second thing, compression.
Compressions, airway, and breathing. So getting a monitoring of the airway and then getting your breaths, your rescue breaths. CAB now. Yes, it's CAB now. Forget the ABCs. They're out. I know, it's not as easy to remember. I know, CAB, yeah. CAB. We'll talk about compressions a little bit. If you're alone, if you're by yourself, a repeated cycle of 30 compressions to 2 breaths is the recommended. If you have a buddy, if someone's there to help you, if someone can give breaths while you're doing compressions, then it's a 15 compression to 2 breath ratio. So if there's 2 people, that way you can utilize getting more oxygen into the child, and the other person can be your compressions or your breaths.
I have a quick question on the
Sure,
breaths.
yes.
I thought, we have a friend that's a doctor, and I thought she said a while back that you don't do breaths at all. But maybe what she was saying was that they just switched it to where the compressions are more
They
important
did switch
now.
it so you would start with your compressions first, so you don't initiate with breaths. If there is for any reason you cannot get an airway on a patient, so no way, no how.
What do you mean by get an airway?
Like if you don't have so obviously if we have a trach kiddo, their mouth to mouth is not gonna be something that we're gonna utilize on a kiddo with a trach. So if for some reason their trach is not able to pass air, if we can't get air in, then it would be adequate to just provide compressions. And I'll get to that in a little bit about the amount of compressions per minute and all of that. So we want to make sure that we're pushing hard and fast, and those compressions, you want them to be 100 to 120 beats per minute. So nobody's going to sit and try to count how many beats they're counting per minute. So one of our instructors said if you compress to the beat of Staying Alive by the Bee Gees, that's about 115 beats per minute, and so that can keep you on beat. And I think, remember to allow full recoil of the chest. So I think we all kind of get hyper adrenaline, we're really in the moment. So you want to make sure you're pulling your weight back off of the child with each compression so that you're not just leaving your weight on the child's chest the entire time. Because you want to allow that heart to completely fill with blood so that way you're pushing the maximum amount of oxygenated blood you can with each compression. Does that make sense? Let's see. So compression depth, the recommended depth is between 1.5 inches for infants and 2 inches for children. So I think that's pretty adequate for all of our kids here today. About 2 inches into the depth of their chest, and then your hand placement should be on the upper half of the sternum. So the sternum goes from the collarbone to that little xiphoid process, that little bone right here in between the ribs. So just the upper half of that. For most kids, it's about the nipple line. It's a good point of reference to push. Any questions about compression?
Should you be,
Yeah.
oh, sorry. I was just say, should be to the right or the left or
Just right in the middle.
right in the middle? Okay.
I have a silly question, but
Yeah, no,
going
no
back
silly
to the 3 things that were necessary, if
Yes.
there's one that's present, don't start CPR?
If there's one that's present, so I'll talk about, when I close, I'll talk about what to do if there is a pulse but no breathing. That's usually what you'll find if you were gonna find one of those and not the other. It would be that there was a pulse but there wasn't breathing. So if that scenario were to happen, you would give 1 breath every 6 seconds and then continue to monitor the pulse. Because a child who is unstable enough not to have breathing at some point is gonna lose a pulse. So we wanna know at that moment and then initiate compressions at that point. But if they have a pulse at the time that you find them unconscious, then you would just initiate your rescue breaths.
Okay,
And
so whatever they're
keep
basically
monitoring.
missing then.
Right,
Okay.
right, you're adding what they're missing.
Okay.
But we still wanna call 911 in
Right,
that situation, because we're gonna need some epi and some other meds, and they're gonna be able to get that to us quickly, so. So breaths, I wasn't gonna talk too much about mouth to mouth, because I know we have a couple of trach kiddos, and, I think mouth to mouth is pretty easily understood. We've all seen like Baywatch and stuff.
Yeah.
So you want to definitely utilize your advanced airway to provide breaths. Do you guys know what an ambu bag is? Do you guys have one of those in your house? Yeah, it's a great resource. If you can grab that, take it with you. I know Marty always puts together a great go bag.
Yes,
At some point.
there's links on our site with all the how to pack a go bag.
Yeah, it's a great thing to just always have with you. Let's see. So if you are unable to provide breaths to your child, if for whatever reason there is no available airway, no way to move air into their lungs, then providing compressions at that same rate, 100 to 120 beats per minute, is adequate. So if they're not breathing, but there is a pulse present. So a child who is not breathing but has a pulse, even if it's weak or slow, breath can be provided at a rate of 1 breath every 6 seconds. So I wanted to talk a little bit about CPR for kids in wheelchairs. I don't know if anybody has a child who is wheelchair bound. So CPR in a wheelchair can be a little bit challenging. We know that compressions are most beneficial when a child is laying on a flat surface, so preferably the floor. So wheelchairs, the main thing you're going to want to do is get the child out of the wheelchair, and that would be the number one thing. Get them out, get them on the floor, get them on a flat surface. If for some reason that is completely can't happen, you can't lift the child, there's nobody around to help you lift the child, one thing that you can do is take the handlebars on the back of the chair and roll the child back to where the handlebars would hit the floor. So I know a lot of our newer kid wheelchairs are made for like extreme stability, so that might be difficult to do. But if we are able to do that where we can get the handlebars so that the child is now sitting kind of legs up in the air back on the floor, then we can unbuckle the child and slide the child out onto the floor. If that isn't something that can be done, I know a lot of the chairs will recline. We can recline them as flat as we possibly can get them, and last resort provide CPR in the chair. If anybody has bedridden children or children who are on vents at night, I wanted to talk about a CPR board a little bit. So in the hospital, when we have patients who are ventilated, who are stuck to the bed, where it would be more dangerous for us to get them out of the bed, away from that ventilator and onto the floor, we utilize what's called a CPR board. So we basically roll them on their side, we put a really, really strong board behind them, roll them back on the board, and we would provide CPR in the bed.
Like a large cutting board, could you use that?
Well, I was going to talk about some DIYers.
I mean,
Not like highly recommended, but I have had parents who have been great at DIY and have, rigged themselves up a little CPR board. I did look, Amazon has, I think the cheapest one they have is about $45. So something to think about if your child at any point is stuck to the bed and really needs to stay there. Something to have on hand for those emergencies. I think it's a great thing to have.
Are the ones in the hospital, are they plastic, wood, or are they?
They're plastic, like a really thick plastic, and then they have kind of handles on the side and then a little notch for the neck. So that would be the thing I would worry the most about DIY, is if you were going to do a straight piece, then the child's neck would at some point get kind of lost in the bed from the compressions. But yeah, a good thing to have on hand for sure. We can briefly talk about the Heimlich. Heimlich is something that can absolutely be done in a wheelchair. Shouldn't be a problem at all. The recommended child choking response is 5 back slaps and then 5 abdominal thrusts. So this is for a patient or a child who is choking but conscious. So choking but conscious, then we can follow our Heimlich maneuver protocols. So 5 hard slaps right in between the shoulder blades at the back, and then 5 abdominal thrusts, and you just repeat that cycle until either the object becomes dislodged or the child loses consciousness, and then we would go back to our CPR protocol and start at the top from there.
How would that look for a 2 or 3-year-old toddler? I mean, as far as the position you would.
So,
like
if he was in a chair, because he's probably like sitting cross-legged or kind of over on the side, or you get your arms underneath his arms, and you're going to want to provide those thrusts right here at his stomach. I mean, even if you pick him up and you're holding him against you, and he's in the air.
Is it right below the?
So you want to be below the sternum, below that kind of like where you would imagine the stomach would be. You're almost like trying to induce vomiting, like that's the force with which you're utilizing those thrusts. So if they vomit after you do the Heimlich, you probably did it absolutely correctly, because you want forcefully to empty the stomach up through and get it whatever is lodged there out.
Okay.
This may sound like a really.
No, there are no dumb questions.
I've always wondered because he has a trach. If he were
Yeah.
to choke, can he still breathe? Because it would be above the trach, right?
Right.
I mean, I know it would still be an emergency.
You guys might be
but-
able to, this might be something that y'all have seen more in your,
I'm not a nurse, so.
Oh, okay.
We can ask Amanda.
yeah, we can have Amanda too, for sure. I don't know that I've never experienced that happen, so I wouldn't be able to speak to that specifically,
Okay.
but, I mean, I would think they would still be able to choke, yes.
Yeah.
Yeah, if it got low enough, I mean, you
Mhm.
can still.
And their coughing response would then be a little bit impaired,
That's true.
but yeah, that might be a good question for Amanda too. She might have some better insight into that or had experience with it.
I think they went exploring.
Went for
When
a
they
walk.
come back, we
Just
can
totally
ask her.
fine.
Well, I think it's really great that you guys are starting the year off on the right foot, kind of getting a good refresher in CPR, first aid. I would really encourage all parents and all caretakers to get CPR certified. I mean, it's absolutely the best knowledge you can have because, I mean, you are going to be there. You're going to be the first line if your child is in an emergency situation. I would like to refer you to CPR-resources.com, and I think Marty's going to put that link up on the website. These are classes taught by local firefighters, so not only are they probably cute, but they're also going to be your first responders. So if you call 911, they're the first people that are going to come. So for them to have some familiarity with your family and with your home, with your child, I think it's a great opportunity for everybody. So they have classes that vary from $10 to $25 depending on how in depth of a class you'd like to attend. So
And
Go
Marty,
ahead.
didn't you say, I'm sorry, didn't you say local fire departments, if you go and you tell them this is my address, I have a special needs
Yes.
child?
Yeah, we were actually, palliative care suggested, with Casey being so complex, that we go and introduce ourselves to our local fire department, especially because we had a modified DNR in place. So if you have any special requests that you would want emergency responders to be aware of, go introduce yourselves to them, tell them a little bit about your child. If possible, take your child with you. They love visitors at fire stations, and they'll give your kid a tour of the fire truck. You know, it'll be a whole fun thing. And one of the things as well with DNRs, if you have any kind of advance directive at all, when first responders come to your house, they need a copy of that. You can tell them till you're blue in the face, we have a DNR, don't do this, but unless you can prove it, it's the law. They're supposed to start doing everything that they're supposed to. However, there were a few things that we learned along the way. If you get a medical alert bracelet that indicates that you have a modified DNR, at least in the state of Texas, that will serve as enough. And then whatever you tell them, they will agree to, so you don't have to go scrambling through your house trying to find a copy of your DNR. So just a few little things. But yes, definitely go introduce yourself to the fire department, and they will be very grateful that you did.
Yeah, because in an emergency, you don't want to be like, we want this done, we don't want that done,
Right.
please do this, because
they don't have time to chat with you.
No, but they'll create a file when you go in there. They'll put your address in, they'll put your child's name, and they'll create a file so that if you dial in and they get your address, it'll pop up with a little alert saying, this is a special house, this is not a typical house, you know, be aware.
Yeah, when you call, you know, you never know how you're gonna react in emergency, and
Right.
first you call 911.
Right.
You know, in the movies, you see them, or you know, talking people through something on the phone.
They
on how
will.
to administer.
They will. And so
Are they
this
going to be familiar with how to do bagging? Then you think?
So yes, they will know how to do bagging.
They will.
They may not, if they don't know that your child specifically has a trach, that's just kind of knowledge I think that they expect that you would know, which is kind of sad but true. But they may tell you to place the bag over the nose and mouth and initiate breaths, and then you would say, my child has a trach, I'm putting it on the trach, this is what I'm doing. So if you talk them through what you're doing, they're able to talk you through what your next step should be, and they can modify what they need to say according to what your needs are also. So getting them on the phone is great. It's a great
Are the people that answer the
resource for
phone,
help. They're 911 operators.
okay, but are they nurses or, I mean?
They're not, but they're certified in a lot of emergency response.
Okay. So they're not paramedics then either?
They're not paramedics, no.
I had a friend who did it and she had no degree at all, actually. But, I mean, she had a lot of training.
Yeah, okay. Good to know that.
Several of the girls I went to nursing school with were 911 operators when they were in nursing school. That was kind of a job they did at night while they were in school. So. everything at once.
Can you just go over the compressions and all that one more time? Just like the number of compressions and all
So,
that?
30 compressions to 2 breaths if you're alone by yourself. 15 compressions and 2 breaths if you have a person who can provide breaths for you.
Perfect.
So if there's 2 people,
30 to 2.
30 to 2. To stay in a lab.
Perfect.
And I think you guys have some handouts too, and all of that stuff is in there as well. And I think I saw even the infant and the adult and the child, all 3 variations.
Yeah, I can just briefly go through these. I just wanted to bring some examples of some forms that we use with our nurses that you guys may find helpful in your own homes. So certainly mark through if you want to write some stuff down. It's great, but it's not going to hurt my feelings. The first couple of pages are go bag checklists. These, as our nurses go into the home, we require them to check these at the beginning and end of every shift. As a family, you guys might decide, you and maybe you have older children or something of that nature that help. Y'all might decide, I'm going to double check that as well every week or every couple of days, just so you can kind of get the whole family involved and really just make sure that it's happening if you don't have nursing or whatever the case may be. These are just some of the things that we supply in the bag, and then parents, of course, are going to put emergency numbers and all of the doctors in there. I think that's really important, especially when you're rushing to the hospital and these ER doctors don't know anything about your child. They've got a good resource place to go. And then all of your backup supplies, and then in terms of other supplies, that might be an EpiPen, that might be a rescue inhaler, that might be an ambu bag, those types of things that your specific situation requires. The second one is specific to kiddos with trachs, because there are definitely some different things that are needed. Your backup trach is always very, very important, the downsize, so that if you aren't there in time and that hole starts to close up, you've got a little bit more room in there for the smaller one. And then again, all of the fun stuff that goes with trach care, so that, if you are out and about and something happens, you're ready to go at a moment's notice. The next couple of things are just scenarios to go through. This might be a fun activity again if you've got other kiddos in the home, or if you guys want to test your spouses, or grandma, aunt, uncle, whoever is involved in the care. The first one is an aspiration precaution. So this could really happen to anyone, whether they have special needs or a G button or even a trach or a ventilator. That could really happen to anybody. Okay, that's page 2. I see. Yeah. Yeah. They do also have a time limit. Again, have a little fun, do a date night with some friends and talk about trach scenarios and emergency scenarios.
That sounds like a fun date night.
It's a little different, but that's the life we live. So, the next one, decannulation, is obviously just for a child with a trach. But again, how to get it back in there, what are the steps, what do I need at all times before the emergency ever happens, and who needs to know this information. Test, grandma, aunt, uncle, whoever is going to come in contact with your child that may for 5 minutes, be alone with them when you're in the restroom or whatever. They need to know those steps just in case. And then obstruction at the back. Again, for trach kiddos, this is really important. I'm not going to go through it again. I'm not a nurse, so I'll leave these up to you guys to read through. Let's see. This page here goes through common ventilator emergencies and kind of what to do. If this is going on, then go here. If this is going on, then go here. I know not everybody has a ventilator child, but I think it's important to just kind of know those steps. And then the next one is troubleshooting for a trach, and it's upside down, so I apologize. Again, if this is going on, you're gonna go this way. If this is going on, you're gonna go this way. And it just walks you through all the steps to getting them back to a stable place.
And we'll have these documents online too, so take them home with you, but if you need a fresh copy, we'll have them where you can get to them.
Yeah. So you can print later if you need it. The next few are just basic CPR techniques, same as we went over this evening. Even have one in Spanish if you have any family members that don't speak English and you want to have this posted in your child's room. It definitely kind of shows the difference between the different ages, which is really important if you have tiny ones, because it is a little bit different, and you definitely don't want to hurt them in the process. So those are just really handy to have. Again, get your family involved at the holidays, or next time you have them over for Saturday dinner, hey, we need to talk about this as a family, really, just in case, and it you never know when it'll be helpful, even in a situation in their own life, that has nothing to do with your child, when somebody might need that information. So, the last couple of handouts are more in depth about trach emergencies. This is really good information, because again, when those things come out, it's a mad rush to make things happen and do the right steps in the right order, and getting your child back to a safe place. So again, I'm not a nurse, Amanda is, and she is, she can answer some questions about this if you guys have any, but I just wanted to have some handouts for reference and whatnot, but certainly feel free to write on them or color in or whatever you want to do. Whatever is going to make you remember and keep your child safe.
Awesome. Does anybody else have questions over here? If not, thank you so much. Emily, you did a great job, and thank you for everything. Thank you, guys.